Medicines and drugs. Medicines are drugs that are used to treat or prevent disease or other conditions. Drugs are substances other than food that change the structure or function of the body or mind. Medicines help prevent disease, fight pathogens, relieve pain, and help maintain and restore health and regulate the body's systems. Some medicines that prevent disease include vaccines, a preparation introduced into the body to stimulate an immune response. Antibiotics are a class of chemical agents that fight pathogens by killing the harmful bacteria in the body or preventing bacteria from reproducing, but leave the patient unharmed. The most common medicines are analgesics, more commonly known as pain relievers. Lastly, allergy medicines, body-regulating medicines, antidepressants, and cancer treatment medicines are all examples of medicines that promote health. Most medicines cause side effects, reactions to medicine other than the one intended. Some medicines cannot be used at the same time as others. An additive interaction can occur when medicines work together in a positive way. A synergistic effect is an interaction of two or more medicines that results in a greater effect than when taken alone. One medicine increases the strength of the other. Lastly, an antagonistic interaction can occur when the effect of one medicine is canceled or reduced when taken with another medicine. Because of all the different effects caused by medicines, the FDA has to make certain regulations for manufacturers who want to supply medicines to the public. For example, some medicines need to be prescribed by a doctor in order to be used. The others are considered OTC or over-the-counter medicines. Medicines also need to come with a list of instructions for use. If you don't follow the instructions, it can cause serious health consequences. Any unnecessary or improper use of chemical substances for non-medical purposes is called substance abuse. Substance abuse includes overuse or multiple use of a drug, the use of an illegal drug, the use of a drug in combination with alcohol or other drugs. People who use illegal drugs are guilty of a crime called illicit drug use. This also includes the selling of prescription drugs on the street. But how bad can illegal drugs actually be? Illegal drugs have serious side effects that can range from minor to deadly and can affect all sides of the health triangle. Overdose, a strong, sometimes fatal reaction to taking a large amount of a drug, clouded reasoning, losing control of one's behavior, and negative effects on your relationships can all come from substance abuse. Despite the legal consequences, the use of illegal drugs can also lead to tolerance, psychological dependence, and addiction. Marijuana inhalants and anabolic androgenic steroids are all common illegal drugs. Marijuana can cause hallucinations, lung irritation, increased appetite, and changed hormone levels. Inhalants are substances whose fumes are sniffed and inhaled to achieve a mind-altering effect. They go immediately to the brain, killing cells that cannot be replaced. All inhalants are extremely dangerous, and many are labeled as poisons. Anabolic androgenic steroids are synthetic substances that are similar to testosterone. All steroid use other than that prescribed by a licensed physician is illegal and dangerous. Some drugs, called psychoactive drugs, affect the central nervous system, or CNS, and alter activity in the brain. There are 4 groups of psychoactive drugs: stimulants, depressants, narcotics, and hallucinogens. Although some of the drugs do have medicinal value, they carry risks even under a doctor's supervision. Some stimulants include cocaine and crack. Cocaine users experience a surge of self-confidence and euphoria when using the drug. Crack, or crack cocaine, is a very pure form of cocaine that reaches the brain immediately after being smoked or injected. It causes heart rate and blood pressure to rise to dangerous levels and is one of the most deadly drugs available. Methamphetamine, or meth, is a common stimulant that is used in treating Parkinson's disease and obesity, but can also lead to depression, paranoia, damage to the CNS, increased blood pressure, and even death. Depressants, also called sedatives, are drugs that tend to slow down the CNS. They relax muscles, relieve feelings of tension and worry, and cause drowsiness. They're dangerous because they slow the heart rate, lower blood pressure to dangerous levels, and interrupt the normal rate of breathing. Alcohol is a commonly used depressant. Narcotics are obtainable only by prescription and are used to relieve pain. Narcotic use can cause euphoria, drowsiness, constipation, pinpoint pupils, slow breathing, convulsions, coma, and death. Heroin is a highly addictive narcotic that is injected, snorted, or smoked. Hallucinogens are drugs that alter moods, thoughts, and sense perceptions, including vision, hearing, smell, and touch. They have no medical use. These drugs overload the sensory controls in the brain, intensifying sensations that can cause hallucinations. The effects are extremely unpredictable. Some dangerous hallucinogens include PCP, LSD, ecstasy, and ketamine. How does this affect us as high school students? Why would teenagers want to use drugs? Many teenagers experience peer pressure in their high school career and can feel pressured into doing something they don't want to do. This is why the first step in avoiding drugs is to make a deliberate decision. All over the U.S., there are drug-free school zones and drug watches in communities to help prevent the use of drugs. In 2012, the NIDA's Monitoring the Future study showed that 13% of 8th graders, 30% of 10th graders, and 40% of 12th graders said they had used a drug at least once in the past year. For those who are already in trouble with drugs, it is never too late to get help from drug counselors, treatment centers, or support groups. Bibliography.